Thank you, Mr Speaker. My question is to the Minister for Health and Wellbeing. Can the Minister update my community as to the progress of restoring Hammil House at Port Pirie to provide aged care facilities as it was prior to the review that's just been carried out? And with your leave, sir, I'll explain further.
Is leave granted?
Thank you. I refer to the Minister's press release on the 27th of August stating that the facility would remain as an aged care facility. I've had several people with their loved ones trying to get into the facility, but have been advised that they are not accepting any new patients, even though there are existing beds, according to those people out there, and no communication from the Regional Health Board.
The Minister for Health and Wellbeing.
Thank you very much, sir, and I thank the member for Stewart for his question and his advocacy on behalf of health services in his local electorate, and particularly at Hammil House. And for people who aren't aware, Hammil House is an aged care facility which is adjacent to the Port Pirie Regional Hospital. I think it's fair to say that certainly for many years the future of Hammil House was under a bit of a cloud. And I think it was within the first year or so of after the election, there was certainly a recommendation to me from the York and Northern Local Health Network that we should close down Hammil House as an aged care facility. It's a recommendation I rejected, and I asked the York and Northern Local Health Network Board to go to the community, to consult with the community, to undertake further work on aged care resourcing and needs in the local area, which, surprise, surprise, did come back and say that we do need Hammil House in the future, and we do need that aged care facility and the capacity that it provides. And I was really delighted that we were able to announce that we will be keeping Hammil House and thank the member for his advocacy in relation to that. Hammil House got down to, I think, 9 residents as of current, but we have committed to increasing that up to 18 residents. To do that, we'll need to recruit additional staff. I understand that there's a recruitment process underway and is open at the moment, and we're obviously hopeful that we will be able to recruit additional staff to open those additional beds and see more residents from the members' community being able to utilise the services at Hammil House. But it's also fair to say that we know, particularly in the Port Pirie area, that there's a need for more nurses, which is also why another area which the member has been a strident advocate for is about establishing a new training facility that we'll be building at Port Pirie as well, working with providers such as the Uni Hub to be able to train more nurses locally, undertake their practical training locally, and create that pipeline for further nurses to work not just in places like Hammil House, but the hospital and private providers as well into the future. The essential answer to the member's question is we are recruiting additional staff to open those additional beds. Obviously, we want to do that as quickly as possible, and apologise for anyone who has been put on the wait list while we're opening those additional beds. We're looking to do that as soon as possible to provide for that additional capacity for residents for aged care to receive that locally at Hammil House.